Hi friends, we all heard about the new wonder drug which would replace glasses all over India. Do you want to know more about that? I am Dr. Gopal s.Pillai, Head of Ophthalmology at Amrita Institute of Medical Sciences, Kochi. The drug is called Pilocarpine, and Pilocarpine 1.25% is used to replace presbyopic glasses. Let's look at what they are. First of all, let's compare the eye with a camera. The eye has the lens and the cornea, which serves the same function as the lens in a camera. It focuses the light right into the retina, the film of the eye. So when the camera has an automatic function, the autofocus of the lens will enable that even if you shoot the camera at a distance or for a near object, they will both come into focus. The same thing is there inside the eye. The lens which is inside the eye autofocuses itself, and this autofocus makes it certain that the distance object as well as the near reading becomes focused on the retina. How is that possible? Because there is a muscle called ciliary body which makes the lens a little more convex and concave. So when the ciliary body contracts, the lens becomes a little more convex, and that process is called accommodation. Now whenever I am looking at a near object, my lens autofocuses. It becomes more convex so that I can read it very clearly. What happens after 40 years? The power of the ciliary muscle reduces slowly as we age, and so the autofocusing ability of the lens will start reducing. That is when at about 40, 42, 43 years of age, people start reading a little distant, a little further, till they cannot get it, and they go to an ophthalmologist and get a near vision glasses. A near vision glasses can now restore their near vision because it's a plus lens. The plus power which is generated by the autofocus is now given by this particular lens. How does pilocarpine come into the picture? Pilocarpine can increase the strength of the ciliary muscle, thereby making the lens a bit convex. Clinical trials have shown that 2 times pilocarpine application, Pilocarpine 1.25% is what gives the best results without a lot of unexpected side effects. So the pilocarpine will increase the strength of the ciliary muscle, and thereby it will cause more convexity of the lens, and that will restore our near vision. So for all people who have presbyopia or near vision problems after 40 years of age, it's a great news that pilocarpine 2 times a day, 1.25% can restore your near vision even without glasses. But is pilocarpine a new drug? No, pilocarpine has been there for the last 100 years for treating glaucoma, the pressure increase of the eye. And for 100 years we have been using pilocarpine, and long-term problems of pilocarpine are well known in the literature. What are they? 1. When ciliary muscle is tightened, you get a little bit of a broache or headache. Can be seen in about 10% of people. Number 2, if there is a central lenticular opacity, a lens opacity or a cataract, pilocarpine can also constrict the pupil, the aperture of the eye. And so when you use pilocarpine in a patient with a central cataract, the central vision can be a little lowered. It is reversible when the pilocarpine's effect weans off in about 4 to 8 hours. The effect of pilocarpine on the pupil also is gone, so the pupil goes back to its normal size, and that decrease of vision can be corrected again. So it's a reversible thing. So for near vision, probably you may have to sacrifice a bit of distance vision in some patients. Number 3, Pilocarpine may induce some changes in the lens itself, which can, over a period of time, cause cataract. That is another problem. So when you are using pilocarpine for a long period of time, you can think that it may develop a cataract. Number 4, pilocarpine induces contraction of the peripheral retina, and the vitreous, which is a cushion-like substance on top of the retina, can be pulled, and it can cause a retinal tear or a retinal detachment in some rare cases. So these are problems which we know from using pilocarpine for glaucoma. We are using 1%, 2% or 4% pilocarpine for glaucoma. So long-term use of pilocarpine for removal of glasses may be fraught with these problems. How will you solve it? You should consult an ophthalmologist, get your eyes examined, make sure that you do not have any lenticular opacity, make sure that you do not have any cataract, make sure that you do not have any retinal pathology, and then monitored use of pilocarpine is what will help you. Over the counter, if you go and take pilocarpine and use it to replace your near vision glasses, it may end up in problems. So, dear friends, you get a consultation done, show your doctor, ask him if there is any problem in the lens or in the retina or any other place, and then only start using pilocarpine 1.25% twice a day for removing glasses. Thank you very much.